if you've ever lived or worked in a place with visible mold and started noticing brain fog, fatigue, sinus issues, allergies, or even headaches, it's natural to wonder if those symptoms are connected. The challenge is that mold-related symptoms can look vague. They overlap with other conditions and often get written off as stress or allergies. So how do you recognize a meaningful pattern without jumping to conclusions? I'm Dr. Kenny, root cause health detective, and I help people sort through questions just like this with clarity instead of fear. And if you appreciate deep dive root cause content just like this, go ahead and hit the like button and I'll create more content just like this. In this video, we're going to look at symptoms that are commonly reported, what raises a red flag, and how to think about these symptoms in your individual context. One of the biggest reasons mold-related symptoms fall under the radar is that they rarely show up in a way that feels obvious. Most people expect something clear and dramatic, like a bacterial infection or a viral infection. Maybe strong respiratory symptoms or something like an allergic reaction. They're expecting something that immediately points them to the environment. But that's not often how it looks in real life. Instead, people may notice things like fatigue that doesn't make sense, or brain fog that creeps in slowly. Also, headaches and migraines, skin changes, or even new food sensitivities that pop up. And one of the sneakiest pictures with mold is that people don't feel like they're bouncing back the way that they used to. And the problem is that each of those systems I just listed by themselves can be explained away pretty easily, commonly written off as stress, poor sleep, too much stress, allergies, viruses, or even hormone changes. And that's exactly why these symptoms and mold toxicity get missed, because mold-related illness does not show up as one picture-perfect symptom. So before we talk even more about specific symptoms, the first thing to understand is this. We're switching the way that we ask questions. Instead of, do I have the one symptom that proves that I have mold, we're going to start a new root cause detective line of questioning, which is, am I seeing a pattern that deserves a closer look? And that leads to one of the most important clues in this entire conversation, the patterns that connect systems involved in mold toxicity that people often miss. So what kinds of patterns usually raise suspicion here? One of the biggest clues that comes up in mold toxicity is when multiple systems show symptoms arriving around the same time. Not just the fatigue or not just the sinus congestion, but maybe for you it looks like fatigue plus brain fog, or skin issues plus headaches, or sinus irritation and changes in your energy throughout the day. Again, individually, none of those symptoms are specific to mold. And this is something that I look for quite often in practice. When we do a deep dive into a patient's history and someone asks me, well, could this be mold? The first thing I'm usually assessing is the pattern of symptoms, not individual symptoms. For one person, it may present as I'm feeling more tired than usual and my brain's foggy and also my sinuses and allergies are acting up more than usual. Or for others, they just say something like my immune system is feeling off, or I keep reacting to things that never used to bother me before. These are the types of clusters that get my attention. Because when environmental stressors affect the body, they rarely influence just one system. We are dynamically interconnected beings. And the research supports this idea as well. A recent systematic review that examined indoor mold exposure found that contaminants in buildings are associated with respiratory inflammation and immune reactions, and in some cases may even influence neurological pathways or nervous system symptoms based on inflammation. What this means, plain and simple, is that mold exposure does not just stay isolated to the respiratory system. And this helps to explain why many people feel that their systems are hard to connect or explain. But when we shift to this pattern-based thinking instead, we can start to connect the clues and the clinical reasoning. And if you like the research, and if you'd like to see the research for yourself, I've put together a free research summary that you can download. It's in the pinned comment in the description below. So the next logical question becomes, why would a single environmental exposure affect so many systems at the same time in the first place? And part of the answer lies in the compounds that are produced by certain molds. Some species of mold produce chemicals called mycotoxins. These are small molecules that are created as they grow, and these chemical compounds can interact with our own chemistry in some meaningful ways. Instead of targeting one single cell or organ system, they can influence broader regulatory systems throughout the body. For example, they can interact with immune signaling, inflammatory pathways, as well as energy production at the cellular level. When those foundational systems are affected, the symptoms can arise in multiple places. And this pattern, too, has been observed in real-world settings. Another recent study looked at workers in moisture-exposed buildings. And researchers found that people in those environments reported higher rates of respiratory symptoms, neurological complaints, and hypersensitivity reactions compared to the normal population. Again, this means that mold illness does not look like one single disease expression. Once you understand that these environmental exposures can affect multiple systems at once, the patterns start to appear. And one of the most sensitive systems in the body that I find in clinical practice is the body's energy creation system. One of the most consistent clues that I try to pay attention to is the energy pattern. And we're not just talking about, I feel tired in a normal sense, but a deeper kind of fatigue that people describe as hitting a wall that I've never hit before. Patients will say a combination of things like, I go to sleep at night, I sleep for 8 hours, but I wake up feeling unrefreshed. Or I was only working for a few minutes in the garden and I had to catch my breath and I couldn't work the rest of the day. Or sometimes it's just that my brain feels slow and I can't keep up with my normal tasks. And one possible reason for these patterns involves energy production at the cellular or the mitochondrial level. Mitochondria are the small structures, the little energy factories inside of each and every one of our cells. When those factories are running smoothly, your body's able to generate enough energy to power every function, from muscle function to brain activity to immune signaling and integrity. But when mycotoxins interfere with this energy chemistry, your production can start to drop. And when that happens, some of the first symptoms that appear are in the brain and in your energy. Research has also begun to explore how living in a damp environment or mold-exposed building may relate to both neurological and mental health symptoms. A recent review showed higher rates of anxiety, depression, and cognitive difficulty in people living in such environments. Now, that doesn't mean that mold is the only factor involved either. And this brings us to another important puzzle piece, because mold rarely acts in isolation. To really understand how mold symptoms develop, we also have to look at the bigger stress picture affecting the body. One of the biggest misconceptions I see around mold illness is that it behaves like a simple on-off switch. People often assume that if mold is present, then everyone in the building should feel sick. Or that if mold is present, or that if mold is the cause of symptoms, that they should be bold and dramatic. Human physiology doesn't really work that way. In many cases, mold toxin exposure is not the only stressor affecting the body. It's often one contributor within the context of a larger stress load. The concept that we use in physiology is called allostatic load. Allostatic load, simply defined, is the cumulative amounts of stressors add up, or the body burden of stress, and not just emotionally perceived stress, but stress chemistry at large. And that stress can come from many sources: environmental exposures, psychological stress, financial stress, sleep deprivation, infections, major life transitions, prejudice and political pressure. Each of these factors adds on another layer. And when enough of those stress layers accumulate, the body's resilience can start to decrease at large. When looking at a patient's timeline, sometimes the symptoms of mold toxicity or that never been well moment happens alongside other major life events. Perhaps the more obvious is moving into a new home or a new workplace, but also starting a new job or having a child, maybe even traveling or studying abroad. Sometimes mold exposure is part of that picture, and other times it represents the tipping point that pushes your systems past their point and ability to compensate. This is also something that confuses many people. Two individuals could be living in the same environment, and one has symptoms and the other does not. That difference lies in a concept that we know as biochemical individuality. Each person's immune tolerance and genetic potential and detoxification capacity or overall stress load are different. So the body's response to a single environmental exposure can vary widely, which is why recognizing patterns can be far more help than, again, trying to find one single explanation. So when someone starts recognizing these kinds of patterns between energy and neurological function and beyond, the next question naturally becomes, when is mold actually worth investigating further? Because the goal here is not to just jump to conclusions or fear mold. We have evolved with molds and mold toxins for millennia. But that said, there are a few clues that can make mold exposure worth exploring. One of the most important clues comes down to timing. Some people notice the appearance of symptoms around the time that they transitioned into a new environment, whether living or working or traveling. Or if you feel noticeably better when away from your typical environments, that can also be an important clue. And we discussed when symptoms appear across multiple systems at once, that can be a huge clue, especially when your symptoms don't respond as you think they should. For example, infections that take longer to resolve, or sleep that doesn't feel restful, or new sensitivities that have popped up that you've never had before. When these patterns show up together, it's important to know that it doesn't prove mold exposure or toxicity, but it can signal that your environmental context deserves a closer look. And in those cases, the next step may be testing. Testing your environment, testing your own chemistry and physiology, and how mold toxins might be affecting each and every one of these systems. But even before testing enters the picture, the most important thing is to start recognizing these patterns. When you start tuning into these patterns, one question that naturally comes up is why energy and brain function and neurological symptoms tend to be associated with mold illness. And that's where the connection between mold and mitochondrial function becomes so relevant. And this video here goes deeper into that exact topic. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.